When you're living with pain like Hilda, it's all-consuming. We've all experienced pain at some point in our lives, and you know, we Brits spent £660 million on over-the-counter pain relief in 2020 alone. Are we, though, spending our money wisely? Dr. Karan Rajan has the lowdown.
Here's a secret about your health that no one ever tells you, and it's going to save you a lot of money. The cheaper generic painkillers is just as good as the more expensive fancy branded painkillers. Say, for example, someone punches me in the face. That doesn't happen very often, but if it did, I'd be very upset. You get the expensive stuff that says it can work on your headache, it can work on your period pains, it can work on your backache, right? But it doesn't focus on that specific area. It goes through your bloodstream and just finds where the prostaglandin is and where it can reduce it. But what about when they say it's faster acting? Does that hold true? So it's not all a big marketing ploy. Fast acting is an actual thing. In order to justify the claim of fast acting, a drug has to have its onset of action within 30 minutes of oral administration. But generic companies and generic painkillers actually have a fast-acting counterpart as well, and they also have to meet the industry standard and the brand leader and have the same onset of action time. So spread the secret to all your friends and save some pennies before Big Pharma come and take me away.
Today, we're taking our technology to help 50-year-old Trudy, who's been suffering from severe pain in her shoulder.
Trudy! Hi! Oh, lovely to meet you. And you?
We're meeting at one of our imaging centres where we use our kit to dive deeper into the cause of her painful symptoms.
How are you doing this morning?
A little bit sore, but yeah, okay.
So, where are we talking about this pain's coming from?
It's in my left shoulder and it goes right up into my neck, and that's where it's excruciating pain. It's right from the base, top of the neck, right the way down my shoulder.
So if you tried to, I don't want to put you in pain, but if you tried to stretch your left arm out a bit, how far can you take it?
This is as far as it goes out. That's as far away from my body that I can actually get my arm, and it's actually hurting at that point.
Oh.
Okay, off we go.
Mother of 3 boys, Trudy lives in West London with her long-term partner and 12-year-old granddaughter.
I am an extremely family person. I spend as much time as I possibly can with my boys and my grandchildren, and try and do as much as I possibly can with them. They keep me young and fit. Can you pick that one up for me, Nicole? I can't reach that one. Like, can you pick up the round flakes for me again, please, darling? Thanks ever so much for your help.
Trudy currently works as a receptionist, but the recent lack of movement and pain in her arm has forced her to take time off.
Can you just pick that one up for me, sweetheart? I can't reach that one either. Thank you. So about 4 or 5 months ago, I started with this niggly pain in my left upper shoulder. I started getting stiff, and then I found myself after several weeks not being able to actually move my arm. To actually move my arm out like that, just away from my body, is really painful. And I can move the bottom part of my arm okay, but it's just too painful to try and move it any other way. I've not been able to do a lot of things. The basic things of being able to get dressed, undressed, sleeping. It always hurts. Some days it's excruciating. So if you can get me out the dish from under here for me. I like to look after my family. So for me to not be able to do it on my own and having to have help is very frustrating. Okay, can you open that for me, darling, please?
For my mum to ask for help, it must be pretty severe, to be honest. She's also a really independent person, so seeing her how she is now, it's kind of taking a massive step back.
A scan has revealed Trudy has a frozen shoulder, a common joint complaint that 1 in 20 of us will suffer from in our lifetime. It occurs when tissue that holds the shoulder joint in place becomes inflamed. It can develop quickly and cause increasing pain, stiffness, and sometimes complete immobility.
I don't actually understand what a frozen shoulder is. Hopefully seeing my problem, it'll help me understand what it is that's actually wrong with me, not just a name of something, but an actual physical image of what it is. I'm just hoping that a cure or something can happen so I can actually move my arm again. I don't know how long I can actually put up with the pain.
Dr. Dimitri Amiras is a musculoskeletal consultant radiologist at Imperial College Healthcare NHS Trust. I'm hoping he can give Trudy the answers she desperately needs and offer a treatment that will get her back to her old self.
All I want to know is what I can do to help myself and just where I go from here.
Hello.
Hi.
Hi, Trudy. I'm one of the radiologists here. I've looked at your scans, and I think it'd be really good if you came through and we can have a look at them together.
Yes, please.
Fantastic.
Can I come too?
Of course you can.
Thank you very much. Trudy, after you.
Thank you.
Trudy's own scans have been combined so she can see her shoulder in 3D and get up close to the source of all that pain.
A frozen shoulder.
It does mean that you
And the
put these silly
treatment?
glasses on,
That's
but they're
fine.
very clever silly glasses. So let's pop them on
Okay.
and see what we can see.
Oh, wow.
Excellent. I'm seeing a skeleton.
I'm going to make it a bit bigger so we can see it a little bit better. Look at that.
Oh, wow. That's
Okay.
better. Oh, gosh.
So what we've done is we've put the scans of Trudy's shoulder here, and you can see Trudy's shoulder. This is actually your shoulder from your scan.
Oh, wow.
This bit here, this is the clavicle. This is your collarbone.
Right, yeah.
Feel across the top of your chest. And then at the back, you've got your shoulder blade, so you
Yeah.
can almost feel the blade at the back sometimes. And then this is your humerus, the long shaft down there.
So this is the long bit of the arm down
Yeah,
here.
exactly.
These images are the key bits of the jigsaw that make up Trudy's shoulder.
Can you see that, Trudy?
I
Have a
can.
little
It's
look.
just really incredible to see inside me. It's
There you
breathtaking,
go.
actually.
Straight.
You can turn around and have a look if you want.
Oh, can you?
Yeah, yeah, go around it, yeah.
Yeah, it doesn't disappear.
Yeah, do you see your shoulder blade
Oh,
there
my
at the back?
gosh. Oh, that's really incredible.
So this is what your shoulder should be moving like.
Wow.
That's incredible.
So you can see, can't you? It is literally like the end of it is a ball moving in a sort of cup.
The shoulder joint is where the end of the upper arm bone fits into a pocket, creating a ball and socket joint. This incredibly flexible joint allows us to move our shoulder in a full
Joints,
circle.
ligaments, capsule, cartilages,
Now, because it's
everything.
such a mobile joint, it allows us to do lots of things, like lift our arms up and touch the ceiling, wave at people, throw spears, throw rocks.
All the things that Trudy can't do, basically.
Yeah, exactly.
Have you, Trudy?
I can't do any of them, definitely not.
I know. You're rubbing it in, Dimitri.
Sorry.
You're rubbing it in.
Most of us take our shoulders' flexibility for granted, and Trudy's desperate to find out what's caused hers to seize up.
What is it that's stopping me from being able to move my shoulder and I've got all that pain? It's all across and then down. So
Do you want to show us on the model?
Yeah, so I'm actually getting pain across the top
Yeah.
and then down this part here and then around the back.